Good day, everyone. I am the third and last reporter for the topic Gestalt therapy. As a continuation, I will discuss Gestalt therapy applied to the case of Stan and the summary and evaluation, which will include the contributions of Gestalt therapy and the limitations and criticisms of Gestalt therapy. For the intended learning outcome, after this report, students should be able to assess how Gestalt therapy applied to the case of Stan and evaluate the contributions, strengths, and limitations of the Gestalt approach. In the case of Stan using a Gestalt approach, it should be understood that the goal of Gestalt therapy is not to facilitate direct change within the client through planned intervention, but is instead to facilitate the client's awareness and insight into himself using creative experiment. The therapy objective for any client is to help the client become responsible and break through his or her stuck points. So the therapy is not directive but is experiential and is conducted through a conduit of the here and now and through the client-therapist relationship. The focus is on the process and not the content. So the conceptualization of Stan's case is that Gestalt-oriented therapy focuses on the unfinished business Stan has with his parents, siblings, and ex-wife. It appears that this unfinished business consists mainly of feelings of resentment, and Stan, he turns this resentment on himself. His present life situation is spotlighted, but he may also need to re-experience past feelings that could be interfering with his present attempts to develop intimacy with others. One of his cardinal introjections was, "I am stupid and it would be better if I did not exist." Also, Stan has been influenced by cultural messages that he has accepted. Furthermore, Stan has learned to hide his emotions rather than to reveal them. For the treatment plan, the method of the expert Gestalt counselor or therapist is creative and spontaneous intervention. The primary goal of Gestalt counseling or psychotherapy toward which interventions are directed is the client's autonomy and progress through enhanced awareness. This, according to UNICEF, in year 1995, it can be called micro-awareness, an awareness of a specific content area as well as a knowledge of the awareness process. So clients can become more conscious of what they are doing and as a result assume responsibility for their behaviors. They can also uncover potential options and alternatives that they may not have been aware of due to a lack of self-awareness. So to help facilitate clients' awareness and growth, in this case, Stan's awareness and growth, the practitioner or therapist does the following. Guide Stan toward becoming aware of how he is carrying old baggage around and how it interferes with his daily life. Assist him in recreating the context in which he made creative adjustments during his childhood years that are no longer serving him well. Then, the therapist is also interested in exploring his cultural background, including his values and the values characteristics of his culture. With this focus, the therapist assists Stan in identifying some of the following cultural interjections, such as don't talk about your family with strangers, and don't hang your dirty linen in public, and don't confront your parents because they deserve respect. Don't be too concerned about yourself. Don't show your vulnerabilities. Hide your emotions, your feelings, and weaknesses. The therapist also invites Stan to examine those introjections to assess their utility in his present circumstances. Although he can decide to retain those aspects of his culture that he prizes, he is in a position to modify or reject other cultural expectations. Of course, this will be done when these issues emerge in the foreground of his work. Next is that the therapist asks Stan to attend to what he becomes aware of as the sessions begins, such as the question, "What are you experiencing as we are getting started today?" Next is that he encouraged Stan to tune in to his present experience and selectively make observations. With this, several figures will emerge. Next is deepen Stan's awareness of his thought, feeling, body sensation, or insight through related experiments. Stan also has learned to hide his emotions rather than to reveal them, and understanding this about him, they explore his objections and concerns about getting into feelings. So the figure of interest now is his hesitation to experience or express emotions. It is important for him to increase his awareness of his reluctance and to explore the meaning it holds for him. Stan says that he can't get his ex-wife out of his mind. He tells the therapist about the pain he feels over that relationship and how he is frightened of getting involved again lest be hurt again. And the therapist asks him to focus inward and get a sense of what stands out for him at this very moment. Lastly, the therapist also asked him to imagine himself in earlier scenes with his ex-wife as though the painful situation were occurring in the here and now. With this, an experiment emerges as a procedure aimed at discovery rather than exercises in the traditional sense. Gestalt counselors and therapists they develop experiments with their clients in order to increase self-awareness and insight. This allows the client to end the unfinished business by taking the situation from the past and into the right now. So, where the client can utilize words, actions, or fantasy to which the unfinished business. So, one of the experiments that could help Stan is the unfinished business type of experiment. So the purpose of this experiment is to resolve the unresolved feelings that have been left over from interpersonal relationships, most notably feelings of worry, resentment, grief, guilt, or rage. This exercise is designed to bring incomplete gestalts to closure. The technique is that the counselor or therapist helps the client to recognize his or her stuck points, then emphasis is on helping the client to recognize and accept what is rather than what could be. Therefore, this is a powerful experiment that can substantially benefit Stan and should assist to alleviate his feelings that is interfering with his attempts to develop intimacy with others. The goal of investigating Stan's unfinished business is to reconcile unresolved sentiments and hurt from his interpersonal connections, most notably feelings of resentment. This activity is intended to bring Stan's unresolved gestalts to a close, so moving these issues from the foreground to the background. And Stan's stuck points can be identified and moved past by the counselor or therapist. The focus should be on assisting Stan in recognizing and accepting what is rather than what may be. To sum it all up, Gestalt therapy is an experiential approach that stresses present awareness and the quality of contact between the individual and the environment. The major focus is on assisting the client to become aware of how behaviors that were once part of creatively adjusting to past environments may be interfering with effective functioning and living in the present. So the goal of this approach is first and foremost to gain awareness. Another therapeutic aim is to assist clients in exploring how they make contact with elements of their environment. Change occurs through the heightened awareness of what is, and because the Gestalt therapist has no agenda beyond the assisting clients to increase their awareness, there is no need to label a client's behavior as resistance. Instead, the therapist simply follows this new process as it emerges. The therapist has faith that self-regulation is a naturally unfolding process that does not have to be controlled. Awareness is a key requirement for the restoration of self-regulation within the person's environment. And with expanded awareness, clients are able to reconcile polarities and dichotomies within themselves and proceed toward the reintegration of all aspects of themselves. So the therapist works with the client to identify the figures or the most salient aspects of the individual environmental field rather, as they emerge from the background. So the Gestalt therapist believes each client is capable of self-regulating if those figures are engaged and resolved so others can replace them. The role of the Gestalt therapist is to help identify or to help the clients identify the most pressing issues, needs, and interests, and to design experiments that sharpen those figures or that explore the resistances to contact and awareness. Gestalt therapies are encouraged to be appropriately self-disclosing, both about their here and now reactions in the therapy hour and about their personal experiences. When doing so will facilitate the therapeutic process. Now let's evaluate the contributions and strength of the Gestalt approach. One contribution of Gestalt therapy is the exciting way in which the past is dealt with in a lively manner by bringing relevant aspects into the present. So the therapist creatively urge clients to become aware of and work with problems that are inhibiting the current functioning. Paying attention to the evident verbal and nonverbal cues supplied by clients is also an effective method to begin a counseling session. Practitioners can help clients increase their present-centered awareness of what they are thinking and feeling as well as what they are doing by using Gestalt therapies skillfully and sensitively. Next one is conflicts and human struggles are brought to life using Gestalt approaches. Gestalt therapy is a creative method that uses experiments to help clients transition from talking to doing and experiencing. The use of active experiments in a creative and spontaneous manner is a method to experiential learning. Clients are given a wide range of tools in the form of Gestalt experiments for finding new parts of themselves and making decisions about changing their way of living. Then, the Gestalt approach to working with dreams is a unique pathway for people to increase their awareness of key themes in their lives. Clients can bring their dreams to life, interpret their personal meaning, and take responsibility for them by viewing each component of their dream as a projection of themselves. Also, Gestalt therapy is a holistic approach that values each aspect of the individual's experience equally. Therapists let the process of figure formation lead them. They do not approach clients with preconceived ideas or an agenda. Instead, they focus on what happens at the interface between the individual and the environment. Then the therapist, they do not attempt to move the client. Instead of attempting to make something happen, the therapist's role is to aid the client, again, in increasing awareness that will allow re-identification with the part of the self from which he or she has become estranged. And finally, a key strength of Gestalt therapy is the attempt to integrate theory, practice, and research. Now, although the Gestalt therapy was lacking in empirical study for many years, it has recently gained popularity. It was according to Stromfeld and Goldman in year 2002, both process and outcome studies have enhanced Gestalt therapy theory and practice, and they highlight a number of notable discoveries based on outcome research which are first is that outcome studies have demonstrated Gestalt therapy to be equal to or greater than the other therapies for various disorders. Second, more recent studies have shown that Gestalt therapy has a beneficial impact with personality disturbances, psychosomatic problems, and substance addictions. Third, the effects of Gestalt therapy tend to be stable in follow-up studies 1 to 3 years after the termination of treatment. And lastly, Gestalt therapy has demonstrated effectiveness in treating a variety of psychological disorders. Let's proceed to the limitations and criticisms of Gestalt therapy. The majority of criticism of Gestalt therapy are directed at the traditional version or the Fritz Perls style, which emphasize confrontation and de-emphasize the cognitive factors of personality. This Gestalt therapy approach focuses more on confronting clients and getting them to experience their feelings. Some practitioners believe that the client's cognitive process is important in counseling or psychotherapy work, yet many Gestaltists tend to de-emphasize cognition. They focus more on feelings. The modern Gestalt therapy has come a long way, with increased emphasis on the theoretical training, theoretical exposition, and cognitive elements in general. Another limitation of Gestalt therapy is the temptation for novice counselors or therapists to use such Gestalt techniques or processes such as the empty chair, top-down underdog, figure ground, and identifying feelings without sufficient practitioner training. However, these techniques alone may be ineffective in assisting the client. Furthermore, if overused or abused by an untrained counselor or therapist, the intense emotional responses elicited by some Gestalt experiments can be damaging to the client. Lastly, contact and interaction between therapist and client are highly valued in contemporary Gestalt practice. So for Gestalt therapy to be effective, first and foremost, the therapist must have a high level of personal development, being conscious of one's own needs and ensuring that they do not interfere with the client's process, being present in the moment, and being willing to be non-defensive and self-revealing all necessitate a significant amount of effort on the part of the therapist. So there is a risk that insufficiently qualified therapists will be preoccupied with impressing clients. The effective Gestalt therapist must have strong general clinical background and training, not just in Gestalt therapy theory and practice, but also in personality theory, psychopathology, and psychodynamics. So competent practitioners must have participated in personal therapy as well as advanced clinical training and supervised experience. Such therapists have mastered the art of combining a phenomenological and dialogic approach that is intrinsically respectful of the client with well-timed experiments. If therapists lack sensitivity, timing, inventiveness, empathy, and respect for the client, their experiments can easily boomerang or cause harm than good. So that is all for Gestalt therapy. Thank you for listening.